So in today's topic, we'll be talking about ergonomics, the desk job setup, and role of a physical therapist. And in bone health, I particularly want to talk about osteoporosis, the risk factors, prevention, and management. So a little bit about me, as Sister Lakshmi said, I did my physical therapy. Actually, I graduated back in India years ago. And when we moved to the US, I took a break to take care of the family. And post that, since 2017, I started going back to job as a PT tech, and then now licensed in Illinois, working as a PT in an orthopedic outpatient setting. And I've been very lucky to have good experience with a lot of the experienced physical therapists around me. Okay, now we'll talk a little bit about what does ergonomics mean. It's an applied science designed for workplaces for safety and well-being of the individuals. That's in a nutshell. But you can see in the image here both whether and more. I'm going to talk more on the desk jobs today. Okay, and ergonomic interventions were part of OSHA, that's the Occupational Safety and Health Administration, recognized the importance of ergonomics for desk jobs, and since 1970 they have made certain changes to prevent and reduce the number of work-related injuries, to increase productivity, and it reduces the cost of the work-related injuries. And another thing was having physical therapy on site has been helpful. Okay, when we talk about ergonomics and don't talk about posture, they kind of go hand in hand. So you can see on the rightmost side in the standing posture, how the alignment, kind of is different in every, all different, the way she's standing. So first of all, I'll define what posture means. Posture means, when you're in a simple term, it's the neutral alignment. So when you think of your head and neck and the shoulders, your pelvis and the lower extremity and your feet. So the way it is aligned in standing and in sitting. So the leftmost image in standing, that's probably the most neutral alignment you can see. And the next to it is, she's more lordotic, where she's kind of more like a pregnancy pose, where she's kind of protruding her belly and she's kind of looking up. And the rightmost here in standing, she is more kyphotic, meaning her upper back is kind of rounded and forward head kind of a posture. So those are not good for you. So you're looking at more neutral alignments. The same thing in sitting as well. The rightmost image shows the most neutral alignment. And I believe a lot of you are working from home, isn't it? So the expectation is, the most neutral alignment, the best ergonomic chair, the table, but the reality is not the same, especially when you work from home. Okay, so I'll talk a little bit about how to set up a workstation. So I'll spend a few minutes on this slide. So there's a lot going on. So we will be sharing the slides with you towards after the presentation, so you can go more in detail with each aspect of it. But just for a broader view, I would say there are a few important things to consider. The distance from the screen to your eyes should be in 1 arm distance. Just for the measurement, and slightly looking down. You don't want to look to way up high, or to, kind of bending down like how we look at the phone or the iPad. And as you can see in the image here, his hips and knees are nicely bent at 90-90 and back well rested. I don't think you always need a neck support, but it doesn't hurt if you have. Elbows nicely rested against the table, on the keypad, nothing too low, nothing too high. So that's what you're looking at. That's the most neutral position, best position to work. But having said that, do you think if you when you talk about the desk job and a full-time job, you're looking at 8 hours a week, 8 hours a day, and 40 hours a week? So do you guys think we can sit in the same position, the most expensive, comfortable chair and a table for all those 40 hours without stretching? I don't think so. So, as much as all of this is important, I think it's important to stretch. How often should you stretch when you are at the table at doing your job? Ideally, it's suggested about 30 minutes to an hour, but I think about an hour, I would say, is a good start. So I will go through a quick flow of stretches towards the end of ergonomics topic. I want to throw out one more question here. Does anybody know about the 20 rule or the rule of 20? Okay, so rule of 20 is every 20 minutes, you are looking away from the screen for 20 seconds, staring at something 20 feet away. So just to give that break for your eyes. So that's a rule of 20. And another important thing I want to mention here is when make sure you have a chair where your hips and your knees are like even, or maybe slightly knees can be lower, but not higher than the hips, which will put a lot of unnecessary strain on the hips. Okay. What's the role of a physical therapist in ergonomics? So PT plays an important role in education, prevention, and evaluation. So I went through a couple of research articles, and one of the things which struck me the most was having a PT on site at the work site has shown to be helpful. And they did a study with randomized control trial where they kind of did different groups. One of the groups which was more successful was having a PT on site with who did the stretches regularly along in their work environment. Post 4 months, they recovered faster. So I think it makes a lot of sense to understand the importance of PT when it comes to ergonomics. Now I'm going to play a quick video on the seated exercise flow. Let me know if you guys can see it. A simple flow starting with your heel raises, okay? Maybe and the toe raises, okay? And then we come to long arc quadriceps, no weight. You can add, if you have weights at home, you can add some weights, short arc, long arc quads. And then you can use a ball or a pillow. I'm using a yoga block. Adductor squeezes. So you're going to squeeze, hold it for 3 to 4 seconds, relax, squeeze, hold it for 3 to 4 seconds and relax. Side bending on the opposite side. You should feel a stretch in your upper trap. That's one. The second one would be, so if this is, I'm looking straight, opposite about 45 degrees of angle, and then extend your neck like looking up. You will feel a different muscle, 45 degrees, and look down towards the opposite knee and slight pull. You can hold on to the chair. You will feel your levator stretch. One would be hold on here and bend, side bend to the opposite side. Okay. So first of all, just a disclaimer, if anybody has any neck pain, radiating pain going down the arm, I would recommend to not do the neck exercises I showed in the video. But if there's no restriction, then it's fine to do it. Okay. So we can all do in the seated position, wherever you are, just the heel raises. And I created this flow thinking that someone who is in front of the desk and in a meeting and doesn't have enough time to do much stretches. There are so many thousands of stretches we can do, but just to keep it simple for the presentation and for someone who is at the desk, I kind of kept it simple. So we can start with the heel raises, about 5 reps, 2, 3, 4, 5. Okay. The same thing with the toe raises. Lift your toes up. 3, 4, and 5. Okay. And then we can do the adductor squeezes. I have a little towel here. Just if you have a pillow, you can use it. Otherwise, don't worry. We can kind of modify with whatever you have. And just squeeze that pillow, hold for maybe 2 or 3 seconds and relax. Okay. Again, same thing. One more. 3, 4, and 5. Okay. Those are your adductor squeezes. And we coming to the long arc quad. So if you have weights, you can use it, put it around the ankle. Otherwise, just lifting. So I'm showing the lower body. I know you cannot probably see it, but I'm literally following the same flow I showed in the video. Just lifting your leg up. Okay. 4, 5. Now coming to the upper body. For the neck, just you can I'm doing my stretch on the left side. So my left hand is holding the chair, bottom of the chair. Just hold it just for support. And you're going to bring your arm over your head and just give a slight pull. You should feel a stretch in your upper trap. Hold it for a few seconds. And come back. Okay. We'll do 3 times and move on to the other side. I usually prefer to do these stretches bilaterally. And back. Again, hold. And back. So when I pull, I'm not putting a lot of force. It's just a gentle stretch. Okay. And the same thing. Now I'm going to stretch on my right side. So right hand is holding the bottom of the chair and give a slight stretch. You may notice one side you may be able to bend further than the other side, and that's normal. Sometimes we are restricted on one side than the other. Back. And again, the third one. Okay. Now in the neck, there are multiple muscle groups. So this is just for your upper trap. Make sure your neck is not stuck with anything. So make sure you're able to move it. And the neck, and again, going back to the left side, I'm going to rotate. If I'm looking straight, I'm looking about 45 degrees opposite side. So I'm stretching on the left side and then slightly look up. You will feel a different muscle stretching. So for this one, if anybody has any radiating pain, like I mentioned, or like a cervical radiculopathy, I would just caution, don't do this one because that will aggravate the pain you have. But if you don't, it's safe to do it. So that's you're kind of stretching your scalenes here. Okay. And the third time. Okay, just for the sake of time, I'm going to move on to the next variation. Okay, that stretches the different set of muscles in the upper back. So same thing, you're looking straight, just look opposite about 45 degrees of angle, and now look down towards the opposite knee and the slight pull. Look, I'm not putting a lot of pressure on my hands, not pulling my neck too hard, just a slight pressure. You'll feel your levator stretch here. Okay. And back up. Again, same thing, rotate and bend towards the opposite knee. Okay. So another one I like personally is the thoracic matrix. I didn't show the whole thing, considering that there might be individuals with back pain and osteoporosis, and I didn't want to add a lot of rotation, but we can still do side bending. So again, on the this time I'll kind of continue to show on the left side. So right hand holding on the bottom of the chair, and you're going to lift your left hand up and do a side bend and back up. So do a side bend, back up. Same thing, 3 times. So working on that thoracic rotation, thoracic mobility is important when it comes to neck and shoulder, because it's all connected. Okay, sounds good. So that's good for just the upper body seated stretches. Okay, I'm going to go back to sharing the screen. Now, I wanted to talk a little bit about how to properly lift objects or toys or grandkids from the floor. We do pick up a lot of items from the floor, and many times the mechanics is wrong. So in the lower part of the image, you can see how he is kind of arching his back when he's lifting, and he's not hinging at the hip and at the knee. He's instead using all his spine, his back, and that's absolutely a no-no. And he's also keeping it away from his body as he picks up, and keeping his, if you see the rightmost image, he's still kind of rounding his back while carrying it. The top of the image shows the right way to lift objects. So he's squatting. You can see how he's hinging at the hip and the knee, squatting down, picking the object, and still keeping his spine nice and straight, neutral, and then keeping the object close to the body. So that's the best way to pick up. I wanted to kind of address that as well. Okay, now we talk about the bone health. The next topic is the bone health. Particularly, I want to talk about osteoporosis. Okay. Osteoporosis, in other terms, is also called as a silent thief. So what does osteoporosis mean? Meaning porous bones. You can see on the image here, the healthy bone is like compact. The outer side is called the compact bone. Inner part is called the spongy bone. It's nice and dense and thick. But whereas in osteoporosis, you can see how porous it is, meaning it's easy to break. It's easy to get a fracture. Now, there are 2 types of osteoporosis, primary and secondary. Primary, age-related, genetic reasons, and more common in females post-menopause. And secondary, probably because of some underlying diseases, side effects of medications, smoking and alcohol, certain increase in certain hormones. You look at the ratio between the female and male ratio for osteoporosis. It's more common in females than males. That's 5:1. So that's pretty high for women. And the next point was kind of mind-boggling. About 2% of compact bone and about 8 to 9% of spongy bone loss per year post-menopause. That's pretty huge. So that's important to consider. How do we prevent it? And also, how do we know what to do for diagnostics? For diagnostic perspective, you get the DEXA scan done in the US after the age of 65. You can get the DEXA scan done every year. There are some exceptions for someone who has had any chemotherapy or on certain medications. They can get it done sooner as well. And that gives something called as a T-score. Anything below minus 2.5 is called osteoporosis. That's just for reference. And I want to talk about why is it important for women, especially postmenopause? How does that impact our bone health? So here in this image, you can see OC and OB and bone. OC, osteoclast, and OB is osteoblast. For the sake of simplicity and making it very easy, I want to call OC as the original cleaning crew and OB as original bone builders. So up until the age of menopause, there are so many other factors which help the bone builders to kind of do their job. And the cleaning crew is the one which is kind of reabsorbs the extra bone matter into they kind of reabsorb. They are kind of cleanup. So post-menopause, because of lack of estrogen, what happens is the bone builders kind of almost not work, or reduction in their work capacity. That impacts the bone health. But the cleaning crew is still doing its job. They still continue to do what they're good at. So they don't care whether it is the extra microfracture that happens throughout the day, they're cleaning that, or they're cleaning the actual bone. So they end up making the bones porous. So it's important to understand how menopause affects women. So there are a couple of risk factors for osteoporosis. Lower BMI, it's seen more common in thinner individuals. Diabetes, more common in women. Alcohol and smoking are other factors. Post-cancer, chemotherapy, certain drugs. And the big one is the lack of physical exercise. Okay. And the way to prevent is by lifestyle changes, dietary changes, taking a calcium-rich diet, vitamin D supplements. And the big one is physical activity. So in physical activity, if you think about it, why is it important? When there are in our joints, there are receptors. Those receptors kind of stimulate these bone building cells, different osteocyte, kind of an osteocyte that's osteoblast, which help create more bone. That's what we need at post menopause. So it's important to include physical activity in our day-to-day life. So how do we prevent osteoporosis in the first place? I did a lot of reading through a couple of research papers, and most common thing that came across was preventing osteoporosis by high impact exercises, by playing sports, like playing tennis, pickleball, running activities, jumping activities, and a regular workout and stretches are shown to be extremely helpful. And say there's osteoporosis existing already, and how do we manage that? There's two aspects in the management. One is, I'm keeping it very broad. One is medical management, and the other one is physical therapy management. So in the medical management, actually this slide, the credit for this slide goes to Dr. Saror from our Psi Center. When he heard the presentation was about osteoporosis, he was very excited, and he gave me these tips to share the medications that are available now with as per the new research. This is just for reference, and I'm not going to go in detail as this is beyond the scope of physical therapy. So there are bone stabilizers and bone builders. And if anybody is interested, this is for reference again. Please go ahead and talk to your provider for more details. So from physical therapy aspect, how do you maintain the BMD, that is the bone mineral density, after osteoporosis? So first of all, see your MD or a PT for an evaluation, and get the diagnosis done. And one of the best baseline to start post osteoporosis or even like osteopenia is start with weight bearing exercises. When I say I want to spend a few minutes on this slide, when I say weight bearing exercises, I mean something in standing, like walking, balance exercises as per your tolerance. So, and also it depends on the functional baseline the individual is at. Meaning, if someone is already walking every single day, 5 times a week, 30 minutes each time, 30 to 45 minutes, that's already a good baseline. So I would work on top of that, I would add some workout, like maybe using the free weights, maybe some resistance exercises. That's a good place to start. So, depending on your functional baseline, I would start there. But for almost everybody who is pretty functionally active and who is able to perform their day-to-day activities, like the activities of daily living, the best place to start is weight bearing exercises. Like I said, walking is probably the best one. And somebody who is already active and participates in a lot of sports, then I would say throw in some high intense activities or put some gym activities like using the leg press, rowing machines, squats. And again, it's very important to do it under a guidance and use a proper form to do these high intensity activities. And it's also important to know what not to do, meaning we sometimes get to know what to do, but we don't know what exactly not to do. So couple things in what not to do: lifting anything from floor and twisting on a fixed feet. So imagine you have something heavy and you're twisting while your feet are still planted on the ground. That is a total no-no pretty much for everybody, not just people with osteoporosis. And when we talk about core, a lot of people think it's just sit-ups. Yes, sit-ups are good, but for osteoporosis in particular, if you think about it, they're already, the spine is kind of hunched. With that, if you do more sit-ups, you're kind of damaging the alignment more. So sit-ups are a no-no, and any jerky movements, sudden movements are also not advised. The maybe category is, as per a lot of the research paper I was reading, they mentioned something interesting. Even after someone is diagnosed with osteoporosis, it was shown that jumping, running, playing sports yielded a lot more bone mineral density than just, say, swimming. Swimming doesn't do much with someone who has osteoporosis. Maybe it's good for someone with osteoarthritis, but not when the bones are porous. So here I put it in the maybe category because, again, we don't know, like, that's best done under a consultation, so that your PT or your medical provider can advise you, depending on your baseline, your prior functional status. Based on that, these activities can be added, or you can work up to it. Okay. And last but not the least, I also wanted to talk about how to prevent fall. So there are obviously many risk factors. First of all, talk to your doctor. When someone takes a certain medication, they are more prone to loss of balance, poor balance. So make sure you are aware of the side effects of medications. Yearly checkup for your eyes, and making the home as a fall-proof environment for safety, clearing the pathways, having a nightlight, non-skid rugs, and such, and using an assistive device. If there's a history of fall, then I would bring it up to the doctor. And also, maybe it's time to talk about using an assistive device. It could be a cane, it could be a walker. Those kind of additions are helpful to prevent further injury. Okay. So, last but not the least, I'm almost on the last slide. So, here, when I saw this picture, when I put it together, the one thing that came to my mind was um, prioritize yourself, meaning invest in yourself. That's the message I got. And meaning, as women, we wear many hats, we play many roles, we are available pretty much for everybody around us, as a mother, as a wife, as a daughter, as a sister. But I think it's really, really important to take some time off for just being, just to focus on fitness. So fitness first, and that's about it for a presentation. And if you have any questions, let me know.
Sairam, Sister Bhagya, thank you for a very practical presentation. I want to start with, offering my, sincere gratitude to Swami for bringing us all together today. And thank you to every one of you for joining today. Hope it was helpful. We'll take questions now. So if you do have questions, please, feel free to type in the chat, or, you can raise your hand, unmute, and ask your questions too.
Sairam, sisters, Sairam Bhagya was a very practical presentation and could relate to it. And, good advice on taking care of ourselves. Think about ourselves. Okay, I have a question. You mentioned about diet. Whenever I talk to my doctor or anybody, they mention, okay, how much protein are you taking? So do you think protein plays a major important part in our diet? I know as vegetarians, we're restricted with just, some dals and others, minimum protein. They say that that's very small amount. So do you think that that plays a role? Just curious.
Yes, I think so. I totally agree with you, and I do relate to what you're saying. My son's biggest complaint is we don't get enough protein in the diet as vegetarians, and I do agree it does play an important role in maintaining that muscle. We spoke more about bone health. Also, it's important to understand after the age of 50, we start losing, not like almost all individuals start losing the muscle mass. So working on those muscle health is quite important. So definitely, as much as possible, I would say it's difficult to get more protein through our diet. But it is an important aspect to consider, and definitely increase the amount of protein in our diet along with the workout.
Okay, and one more question related to that. It's osteoporosis is not just the body. You have, like starting with your hands, your wrist, and all that part. So there's like just doing some exercises for those too, right?
Yes.
Because that's how it started. Like personally, like I said, when I said I'm able to relate, I could feel it, like pain and stuff like that, because more towards the menopause. So
yeah. Yeah, definitely. I mean, like I think there's two different things. One is the changes in the joint due to in something else called as osteoarthritis. That's common as well. But today I spoke more about osteoporosis, which is post-menopause. We kind of lose the bone mineral density. So both have a different problem. For osteoporosis, you are looking at more weight-bearing exercises. For osteoarthritis, you're looking more at activities like swimming or cycling. So I always tell my patients to kind of do a combination of both. So anyway, it's advised to do high intensity exercises for osteoporosis 2 to 3 times a week. So the other days, you can do something non-weight bearing like swimming or cycling or stretches. So kind of keeping more like a cross training does help maintain that muscle and the bone health.
Sairam, I have a question about knees. If there is a cracking sound, like I want your pointers about, is it like a loss of fluid or what should we do about that, or what kind of exercise or diet for
Sure.
knees?
Sure. Do you hear the cracking when you walk or how?
Yeah, when I climb the stairs.
Okay. So I don't know the whole history, but I would say uh, it's probably arthritis, but again, don't take my word for it because I haven't seen you, I haven't evaluated. But I would say any sort of does it lock or pop or any other issues going on with the knee? Any injury?
No injury, no logs, but I will hear some popping sound every now and then.
Okay. Okay. Are you comfortable sharing your age?
45.
Okay. So at this age, we also go through a lot of hormonal changes. So it's actually a good time for you to start doing those exercises based on your functional, status. Meaning, if you're walking every day, I would continue to do that and add a little bit more strengthening exercises. And I don't. After the age of 22, we all have some arthritis in our joints. It's not super, like, it's not a red flag or anything. But at the same time, if it's catching or locking or giving away on you, then I would go see the doctor. But if it is just you hear the cracking, but it's not associated with pain, then I would say it's okay. Work on strengthening.
Okay, yeah, thank you so much.
So we do have a couple of questions on the chat.
Yes.
I'm just going to
Okay.
go with the most recent one. Can you please show how to get up after sitting on the floor?
Okay.
That's from Sister Hema.
Okay. From the floor here. It depends. So sitting on the floor is one, and getting up is another one. So it depends on everybody's the baseline, how fit they are. If you are, if you're here, say I'm sitting for bhajans, I just get up this way, right? Pretty flexible and fit. But if someone is struggling, and then I would say I would bring one knee up and bring the other one up, and then go down here. So you need a lot of hip and hip mobility. So you kind of go into kneeling position and then come into half kneeling and then come up. So you're looking at from kneeling and then half kneeling and then kind of push yourself up. If you have a chair or some sort of a support, you can use that and come up. So it depends on your functional baseline.
That's good, Sister Bhagya.
Okay.
That was a good demonstration. And we do have one more question here. What are your recommendations for Sai spiritual meetings in terms of ergonomics, stretching, exercises, especially during Akhand Bhajan, Sai 100 Bhajans, retreats, and Sunday Sai activities for different age groups, especially 60 to 70 and 71 to 80? Do you suggest group exercises for 5 minutes without upsetting ongoing programs?
That's a good question. Very practical question. I know during Akhand Bhajan for sure, and even the 100 Bhajans, I've seen that it's hard to sit for so long. So what I would recommend is, first of all, take just like how it's recommended to take breaks during when you sit for too long at a desk. Very similarly, I would say take some breaks as needed. depending on your again your baseline. So maybe every 45 minutes, it's difficult to get off a bhajan session when bhajans are really at the peak, but I do get it. As needed, take breaks. But I would say doing a group exercise within when the program is running is difficult. I think that's going to be a difficult one, because it can be, as much as we want to get back, we want to stretch, but we want to get back to the bhajans as well. So if we have a huge crowd away from the bhajan, we're going to be, I think personally, I'll be distracting people from their connection with Swami. So it will, as an individual level. So at our Sai Spiritual Center, we have stairs. So I can show some standing exercises, like doing your hamstring stretches, even in the seated position here. I can show you can do some, like the hamstring stretches, just lifting your foot up, you can kind of hinge at the hip and stretch that hamstring. I don't know if you can see it, or I can share the videos as well. I have some videos on that. So stretching your hamstrings, that's a good one. Just take a break, walk around, drink water, come back to bhajan. That's probably the best, I would say.
And there's one more question. What do you suggest if the knee hurts? Because after doing exercise, the pain disappears. But if the knees have been stagnant, for example, due to working on the computer, the pain returns.
Yes, that's a very common thing I see at work too. So it means that you need movement. So the movement is medicine. That's what one of our professor called motion is lotion. So I started calling it as movement is medicine. So make sure you are moving your extremities, especially if you're at the desk for longer periods of time. So the more you move, seems like arthritis kind of a thing going on, meaning with arthritis, it's a little tricky, because if you don't move, it hurts. You move too much, it hurts. Meaning, there was a research on osteoarthritis where people ran for, like, say, about 10 miles every single day, or maybe 15 miles. And they had more arthritic changes. It impacted the knee negatively. On the other hand, there were individuals, they didn't do much exercise, they didn't do much. That also impacted negatively, meaning either ways, it impacts negatively. So having it, just find the sweet spot. So that's where your cross training helps too. So kind of combining some weight bearing and non-weight bearing exercises, like swimming and walking, those are good. Like biking is a good one. So I think your knee wants to move more.
Thank you. There's one more question from Sister Hema regarding recommending using the jump rope.
So with the jump rope, it's definitely not a bad exercise. It's a good exercise, as recommended through many research papers I read. But there are a couple considerations to think about. Number one is talking about your pelvic floor muscle health, meaning if a lot of the women, after kids are born, our pelvic floor is weak, and you want to make sure there's no uterine prolapse or any kind of underlying issue going on. So jumping is safe if everything is fine. And also, it's a good idea to throw in some pelvic core exercises along with jumping. And using a jump rope, there are, like, when I haven't done yoga in a while, but when I was doing, my yoga instructor had us do like the just jumping in place, meaning we didn't have any jump ropes, but just just jumping in place, pretending to have a jump rope. I think that is also safe depending on your like balance and ability to take off and come back, land using a jump rope. I think it's easier and safer to just kind of pretend, but at the same time being able to jump.
Thank you, sister. So I do have a question, Sister Bhagya. Like, do you have
Yes.
any recommendations for free weights? Because I know you mentioned, like, are there any tips, 1, 2 pounds, 5 pounds, like repetitions, any
Yes,
suggestions?
that's a good question actually. So as per recommended, so in general, I would say depending on the baseline you are at, you can say I have some 5-pounders, 8-pounders. If you are comfortable, go ahead and use those, like the bicep curls and overhead press and stuff like that. But particularly for osteoporosis, the recommended repetition max is 70 to 90% rep max for 8 to 12 reps for 2 to 3 days in a week. So that's just for osteoporosis. In general, I would say if I'm able to lift 100 pounds, that's the maximum I can lift. That's 1 repetition max. So if you go on Google, you will see a whole list of what should be your repetition max based on your capacity to lift the amount of weight you can at once. So say 70% would be maybe about 70 pounds. I'm just keeping it mathematically easy, but you can definitely start from 2 5 pounds. Those should be easy to kind of start lifting some weights.
I have one more pointer I want to ask you. So, is the arthritis related to being overweight? I know age is another factor. Is overweight a factor for getting knee problems, especially arthritis?
Yes, it does. It does affect the knees because the knees end up taking a lot of that extra weight, and it does impact the cartilage between the knees, and kind of more wear and tear happens. So definitely, weight does impact the knees.
Sairam,
Sairam.
wonderful presentation. I'm 80 years old. I've
Okay.
had a 2 knee replacement surgery, and then
Okay.
the shoulder, one shoulder, right shoulder. Now it's painful. I saw my orthopedic surgeon, and
Okay.
he gave me 2 options. Come every 6 months, take a shot, that,
Okay.
or you can go for a shoulder replacement. But
Okay.
I'm trying to avoid going to the surgery.
Right.
I wanted
Right.
to do, but I'm cooking. I do go for my grocery shopping. I do walk at least 3 days a week,
That's
1.5
good.
to
Yeah.
2 miles. I do.
Okay.
I do some yoga, little bit of yoga and stretch
Okay.
exercise.
Okay.
My question is, can I live with that kind of activities right now I'm doing? Can I avoid the surgery?
Yes, I see a lot of your age group is probably one of my favorites. There's so much energy, there's so much positivity, and thanks for asking the question actually. So I would say avoiding the surgery, again, it's a personal choice, or going for it is also a personal choice. But having said that, I would like you to I can connect to you one-on-one later on as well, but the best thing for you to do is to try and maintain the range of motion you have. If you haven't had PT consultations, please go for those. That is helpful because the PTs can guide you as to how much exercise to do, and how they can help with some of the basic home exercise program as well. So I would love for you to continue to maintain that range and the strength in your shoulder.
I'm trying my best, but
Yes,
I can lift only 1 pound, little bit,
that's
not above my head,
right.
only in a little bit. And then
Okay.
I take a shower by myself. I'm trying to
Okay.
do everything by myself in a slow motion. And
Okay.
only thing is that little bit of that pain, that
Yeah.
that prevents me to get socialized, But otherwise, I'm functional. I would.
Okay.
I'm doing whatever is good for me. Thank you,
Right.
Saira. Thank you.
Thank you. Thank you.